everyone, and welcome to In the Know. I'm Lisa, and on today's segment, we are going to continue the healthy lifestyle theme, where Andrea was able to catch up with United Healthcare. Let's take a listen to their tips.
Medications work best when taken as prescribed, but coordinating more than one medication can be challenging. United Healthcare's Dr. Chris Kleather, Chief Medical Officer for United Healthcare, Medicare, and Retirement in Pennsylvania, is here to talk about medication adherence and share tips for older adults on how to manage multiple medications safely and for optimal health. We have a lot to cover, so let's get right to it. Dr. Kleather, what is medication adherence and why is it especially important for older adults?
When we talk about medication adherence, we mean taking your medications as directed by your doctor or pharmacist, and it also means following the proper schedule for each dose and completing the medication as directed. Proper medication adherence also includes understanding the potential for interactions or side effects of each medication. Taking medications incorrectly or skipping doses can have serious adverse health effects.
So what should people be aware of if they are starting a new drug or taking more than one medication?
Yeah, it's very common for the number of people's prescriptions to increase as they age and are managing more health conditions. Some helpful things to think about as you begin a new medication include bringing a list of every medication you take, including prescription and over-the-counter drugs with you, to the pharmacy each time you start a new medication. Be sure your primary care provider and any specialists you are seeing are aware of all the medications you are taking, and avoid filling your prescriptions at multiple pharmacies.
Great advice. So it sounds like this can be a lot to keep track of. What are some ways people can manage multiple medications more easily?
It can feel overwhelming to manage multiple medications, but it doesn't need to be. The first step is to create a calendar that includes all the medications on your list. This will help you keep track of the medications you are taking. Getting the right kind of pill organizer can be very helpful. And don't forget to explore mobile apps for use on your smartphone or tablet, which have built-in alerts to help you remember to take the right pill at the right time.
Great recommendations. So once a person has a medication plan, can you offer any tips to help them take their medications on time, all the time?
You may be able to order a 90-day supply of medications through home delivery by mail. Keep your medications in a place that is sensible and convenient for you to access. And lastly, try and establish a routine, such as taking your morning pills at the same time you brush your teeth every day.
That's great advice, that routine. Are there any other resources you would recommend, Doctor?
Your pharmacist is a great resource for any further questions, or you can visit uhcmedicareplans.com. Such
great information. Thank you so much for joining us, Doctor.
Thank you.